Part of the community regeneration bill that I mentioned in the Livable Cities Initiative is urban farming, urban gardening, so we can get healthy food back into our neighborhoods. So this is part of a comprehensive plan. As we had the neighborhood stabilization money that comes in, we knock these old dilapidated houses that are crime infested, we get them down, we turn it into green space, we turn it into urban gardens, we turn it into urban farms, and we use that fresh food to feed the folks that live in these food deserts in our cities. It's critical that we do that to make that happen. And not to mention, the most significant thing that's happened is we passed a comprehensive health care reform bill that says every single person in the United States of America will have health care. Will have part of that is making sure that everybody has a health care card. Insurance companies can't deny you health insurance because you have a pre-existing condition. They can't deny your kid health care because they have a pre-existing condition. We had 1,700 families in this community last year go bankrupt because of a health care issue that they had. 1,700 families had to go and file bankruptcy in the United States of America, right here in this community alone, because of health care. And we fixed that. And you want to talk about reducing health disparities? In the health care bill, we just got $13 million for the Eastern Gateway to train health care workers that came out of the health care bill. And there will be $11 billion over the next 5 years that will go to community health clinics in areas that are underserved. So we are putting billions of dollars into preventative health care in neighborhoods that need it. If you want a workforce to be able to go to the community college to get trained, they got to be healthy. If you want our kids to learn in school, they got to be healthy. And that, you know, people say how much the health care bill costs. What has it cost this country not to have universal health care? How much does it cost?
Mr. Graham.
Thank you, Bill. What it'll cost the country in 10 years is $2.5 trillion. In addition to the deficits that we already have now, it will mean the destruction of the medical services that we have available. Every single person in this country has access to medical care. There are those that can't pay for it at some point. The clinics, the hospitals, and the medical practitioners wind up eating that and taking care of it. What's going to happen here in the short term, we passed a couple of good things. In the long term, the actual service doesn't start until 2014. So we're going to be taxed for 10 years. And by the way, healthcare is going to be more expensive, not less expensive. Physicians, you can talk about an 800-pound gorilla, Mr. Ryan, here's the gorilla. The physicians are going to refuse to provide health care under the Medicare and under the Medicaid system. Surprise everybody, we have trouble finding physicians to pay you. So there are going to be a lot more people on Medicare and a lot more people on Medicaid, a lot less physicians providing the care. You're going to wait, and at some point, someone's going to make a decision about whether you get the pill or whether you get the hit. That's what's in there. 50,000 new IRS agents, 159 new bureaucracies requiring who knows how many 100,000 more federal bureaucrats that we have to pay for that don't provide medical care, just write rules and regulations for a 2,700-page bill you never read.
At this time, I'd like to give each candidate 3 minutes to address the crowd about their campaign and their hopes for the Valley. We'll start with Mr. Graham and then go to Mr. Ryan.
Thank you, everybody. It is an honor to be here, and I appreciate everyone waiting to hear us speak. I'll tell you this. I became an American citizen when I was 16 years old. On that day, I pledged to become an American, one of the proudest days of my life. I have the qualifications, the education, and the backbone that it takes to become a congressman and to do what needs to be done. We've got a mess in Washington. Here's my qualifications. I've got 35 years in actual health care provision, providing health care to those who could pay it, those who could not, the unborn and the very old. I've been there and done that, 20 years on our intensive care unit. I have saved both mother and child at the same time, don't have to sacrifice one to save the other. I have 30 years experience as a business owner in Warren. I grew up in Warren, the west side, just like Bill said. 30 years as a business owner, 30 years as a college educator, 29 years as a law enforcement officer, and 18 years as an adult Boy Scout leader, a mentor to the Boardman High School, middle school. I have spoken to 6,000 students in 19 different school systems about drug abuse and personal safety issues. I have life experience. I have a backbone. Nancy Pelosi will not be my boss. Barack Obama will not be my boss. John Boehner will not be my boss. You will be my boss. I'm going here as your voice. Something we haven't had here in a long time. Thank you.
My hope is to continue what we've been doing in this community for the last few years, and I think anybody who's been paying a little bit of attention will see that we have come a long way in the last few years, and we're going to continue going down that road, and no one's going to stop us. I don't care who they are, because we have laid the groundwork for long-term economic development success in this community. And what we have done, I talked about China and some of the national things that we need to do, but we need to increase the level of education here. We've brought back millions of dollars. We've brought back millions of dollars to make sure teachers weren't laid off in Warren City schools and schools all across the congressional district during this recession. We brought back $5 million to make sure that there are firefighters in the city of Warren, so that if something happens, you have that kind of protection. At the federal level, we've increased Pell Grants by billions of dollars so that anybody in the United States can afford to go to college. We threw the banks out of the student loan program and included 8 million more students in being able to access student loans. We've reduced the rate for student loans so you have less to pay back. We said if you go to school, you take out a student loan and you pay that loan back, you can't pay more than 10% of your income so you don't get weighed down if you go to college. And after 10 years, if you're in public service, we will erase the loan. In 20 years, if you're in the private sector, we'll get rid of that loan. We're investing into education. If you take the city of Warren, for example, we are reinvesting. And what I've been able to do with our office with earmarks, we need to have national programs that do this. Just go down Mahoning Avenue. We were able to get, I think, $3 or $4 million for the Packard Car Museum. There's now an expansion there. $1.5 million for the Packard Music Hall. A roof on the amphitheater that's blowing the doors off in the summertime now with Weekend at the Amp. Thousands of people in downtown Warren. Go down into the square where we have about $5 million for a Warren Business Energy Incubator, so that the Packard brothers that we were talking about that led to Delphi having 16,000 employees, we want to recruit from this entire region who are the next Packard brothers. We want them in that incubator. We want to support them so that we can grow our own jobs here. No one's going to come in here and wave a magic wand for us. We've got to do this ourselves. Let me tell you the future. And you can hear a lot of rhetoric about this. We spend $1 billion a day, leaves the United States of America, for cheap energy in other countries. And then all these people screaming about all the money we're spending. Where were they when we started 2 wars and spent billions of dollars? $3 trillion and we get a bunch of slackers. We want to spend a few $100 billion here that's actually going to reduce healthcare costs to make sure that every United States citizen has healthcare in the United States of America. These are the investments we're going to make. We're going to continue to make them. National and international folks are recognizing what we're doing here, and we're going to keep making it happen. Thank you.
Some questions from the audience, and a couple of them are addressed to the 2 congressional candidates.